Join the fun and stay connected.
Good morning, viewers, and welcome to another episode of the Wellness Hour, your trusted source for health information, brought to you by the Ministry of Health, Wellness and Elderly Affairs in association with Hot 7 TV and sponsored by the Caribbean Development Bank and Interdevelopment Bank. My name is Delphina Verna. It's a pleasure to be with you once again, and as usual, we have a very packed show, very interesting discussion happening a little later on. Just before we get into that, just to give you some information on some of the activities taking place in the Ministry of Health in the past few weeks. So to begin, we will look at the launch of the Vector campaign. I mentioned this sometime before, and letting persons know, again, we are in the hurricane season. That is when we have increased cases of vector-borne diseases, especially dengue. And so the Environmental Health Division of the Ministry of Health launched its Vector Awareness Campaign, taking steps to combat vector-borne diseases in country by launching this awareness campaign under the theme Stop the Spread. Controlling vectors starts with you, so we each have a responsibility. Some of the activities to be undertaken include road shows in various communities and also some workshops showing persons how to do proper drum covers, multiple education sessions, summer camps, and targeted surveillance activities. Let's take a short clip from that ceremony.
Ministry of Health, Wellness and Elderly Affairs recently launched its Vector Awareness Campaign under the theme Stop the Spread, Controlling Vector Starts With You. The campaign aims to strengthen the country's action to combat vector-borne diseases through public awareness, community engagement and activities. Some of the vector-borne diseases are dengue, chikungunya, Zika, yellow fever and leptospirosis. The Vector Awareness Campaign will roll out with activities such as road shows in communities, drum covering workshops, children's summer camps, continuous school education sessions, targeted surveillance and simulation exercises. Chief Environmental Health Officer Cheryl St. Romain reiterated the need to safeguard the health of the nation and the need for society on a whole to play their part in controlling vectors.
This campaign is not just another health initiative. It is a call to action because effective vector control is not solely the responsibility of health authorities. It requires a whole of society approach, from households to schools, workplaces to local councils. Each of us has a role to play in eliminating breeding grounds, promoting awareness, and adopting safe and sustainable behavior.
All right, and there you have it. And once again, just to reiterate, we each have a personal responsibility to, look around your homes, ensure that you don't have any mosquito breeding grounds, clearing the drains, no empty containers, collecting water. We each can do that to contribute to the awareness and to the decrease in the levels of vector-borne disease. Also happening in the past few weeks, the Ministry of Health once again receiving a donation and making a contribution to the Owen King EU Hospital through the support of the Health System Strengthening Project and the Japan International Cooperation Agency, JICA. So there was a donation of biomedical equipment to the Millennium Heights Medical Complex, which is expected to enhance patient care at the hospital. The biomedical equipment included ECG machines, nebulizers, suction machines, defibrillators, and ICU patient monitors, to name a few. All very critical pieces of equipment there. Let's take a look.
To strengthen St. Lucia's capacity to deliver advanced healthcare, the Biomedical Engineering Unit within the Ministry of Health, Wellness and Elderly Affairs recently handed over a suite of essential biomedical equipment to the Millennium Heights Medical Complex. The equipment, ranging from diagnostic tools to life-saving machines, is expected to significantly improve patient outcomes, bolster clinical efficiency, and reduce downtime in critical departments at the hospital. The Permanent Secretary in the Ministry of Health, Wellness and Elderly Affairs, Jenny Daniel, emphasized the critical role of partnerships and receiving their support through donations to ensure people have equitable access to life-saving care.
We always look forward to the partnerships that we have with JICA, with the HSSP, the World Bank Group, that facilitate us in this process. Of course, biomedical equipment is not a luxury. It looks very expensive, it costs a lot, but in terms of hospital, it is not a luxury. It's really an essential, necessary component of the delivery of healthcare and providing service to the public. We really entrust it into your care. We look forward to the sustainability of these pieces of equipment, ensuring that they are used in the manner that they are meant to be utilized, and to, of course, ensure that there is equitable access of all our patients, all St. Lucians, to the very life-saving, life-giving, and, of course, determining diagnosis, etc., for our patients.
Always looking for ways to improve the efficiency and delivery of patient care. So at the Ministry of Health, we really value and are grateful for these partnerships that we have with external agencies that help us in fulfilling our mission. And as we go this week, we have a very special episode of our Trailblazer section. So in lieu of that, we're doing a special feature tribute today to one of the long-standing employees of the Ministry of Health who just proceeded on pre-retirement leave. Today, I invite you to join us as we honor Ms. Cheryl Saint-Romain, who is the Acting Chief Environmental Health Officer in the Ministry of Health, in the Division of Environmental Health. You would have seen a little bit of her in our first news clip. So let's honor the legacy of Ms. Cheryl Saint-Romain.
We celebrate the incredible journey of Mrs. Cheryl Saint-Romain, a leader and advocate in the field of environmental health. Her career began in 1989 as an environmental health apprentice, just 6 months after graduating from St. Joseph's Convent. Inspired by a community-based vector control project in Bocage, Mrs. Saint-Romain found her calling early, empowering communities through health education and sanitation. From her first assignment in V4, she quickly proved herself, taking on responsibilities far beyond her title. Her passion for growth led her to Jamaica to pursue a public health inspector's diploma and later a master's in public health from UWI, where her grit and determination shone through. Upon returning, she rose through the ranks, becoming the first woman to act as Assistant Chief Environmental Health Officer, and in 2024, the first female to serve as Acting Chief Environmental Health Officer. She led with distinction across sport health, food safety, vector control, and the regulation of mass gatherings. From resolving a major public health crisis affecting a school in the south, to leading St. Lucia's emergency response to the Lady's Eye cargo ship incident, her leadership left a lasting mark. Internationally, she represented St. Lucia at high-level meetings on chemical safety, the Mimata Convention, and served as the focal point for climate change, and was also a member of numerous national boards, including the St. Lucia Bureau of Council, the Development Control Board, the Tourism Certification Board, and the Public Health Board. One of her most defining contributions came with the establishment of the Institutional Health and Hygiene Program, which she led with excellence. Now, after 36 years of dedicated service, she ends her tenure where it all began, with community mobilization, launching the 2025 Vector Awareness Campaign. Mrs. Cheryl Saint-Romain's legacy is one of courage, innovation, and service.
Mrs. Cheryl Saint-Romain, 36 years of service to the Ministry of Health, Wellness and Elderly Affairs, and we definitely want to wish her all the best as she goes on a pre-retirement leave, and hope she has, enjoys, has fun before she officially retires. We will go ahead and take a short break now. I do invite you to stay with us. When we return, we'll be introducing our guest. And today we will be speaking about the National Blood Bank. This is something that should be near and dear to all of us. Blood donations save lives. We will be having a very interesting discussion, hoping to answer all your questions. So please stay with us. We'll be right back.
healthy fats found in some foods. However, it can also be formed from our cooking habits. Did you know that reusing oil when frying can create trans fats? Or that using healthy oils for frying foods at high temperatures can also generate trans fats? Yes, it can. Avoid such practices to protect your health.
This message is brought to you by the Nutrition Unit of the Ministry of Health, Wellness and Elderly Affairs.
Now you can take Hot FM, Kiss FM, and Hot 7 TV with you wherever you go. Whether you're in St. Lucia or exploring our four corners of the globe. Our record-breaking app has already been downloaded over 500,000 times on Google Play and the Apple App Store. To bring you the best in HD sound, we've relaunched a brand new app. Get it for free in the App Store by simply searching Caribbean Hot FM HD. Listen to us in real time, anywhere, any place, anytime. We've added so many cool new features, like our live in-studio option, where you can see your favorite announcers and DJs at work. So download the app today. It's free. Spread the news. St. Lucia is now in HD around the world on the Hot FM app. Don't miss out. Join the fun and stay connected.
In times of grief, Hot 7 TV and Hot FM are here to support you. We offer deaf announcement packages for both radio and television at affordable prices. In fact, when you choose to place a deaf announcement on Hot FM with more than 2 airings, you will receive a free telemetry on Hot 7 TV. At Hot FM and Hot 7 TV, we understand the pain and difficulty you are experiencing during this time of bereavement, and we are committed to helping you in any way we can. On Hot FM, deaf announcements are broadcast from Monday to Saturday from 6:30 a.m. On Hot 7 TV, they are aired on weekdays at 7 a.m. and 1 p.m. and on Sundays immediately following the live broadcast of the church service at the Barbono Good Shepherd Catholic Church with Father Albert. If you are in need of such services, we are here for you. Contact us at 452-6040.
Here's your guide to installing Hot 7's digital antenna.
Please note that all TV sets manufactured today have a digital tuner. TV sets manufactured before the year 2005 may not have a built-in digital tuner, and you may not be able to receive our free-to-air digital transmission on Channel 7 to receive our free over-the-air digital HD TV service. Number 1. Plug your antenna into your TV set's RF input jack labeled antenna or cable in. Number 2. You will now have to scan for the digital channel. Please note that all digital TVs are different in terms of scanning procedures. The following is a general guide, but the steps or the terminology may be different for your device. Press the menu button on your TV remote. Go to Setup or Settings. Go to Installation or System or Channels. Go to Scan Channels, Program Channels, Auto Scan, Auto Program, or Auto Tuning. Press Select or Enter or OK to start the scan. When the device says scanning is complete, accept the channels found and close the menus.
Manufacturers can claim that a product is trans fat free if it contains less than 0.5 grams of trans fat per serving. However, this doesn't necessarily mean that the product contains no trans fat. Look for the words partially hydrogenated or shortening in the ingredients list to identify the foods that contains trans fat.
This message is brought to you by the Nutrition Unit of the Ministry of Health, Wellness and Elderly Affairs.
Welcome back to the Wellness Hour. My name is Delphina Vuna. Thank you so much for staying with us. As I said, we have a very packed show. Today, we will be focusing on the National Blood Bank. Now, this is an issue that I think is very important for us to speak about. Some of you may have noted or seen the press release coming out from the Millennium Heights Medical Complex, where the blood bank is situated, requesting persons to urgently donate over the weekend. And this was a result of the blood bank experiencing a serious blood shortage. And that is something that we have been seeing quite frequently. I think more than months, years even. And something else that we see very often is families and persons posting on social media and sharing the need for blood by their relatives, friends, and asking persons for urgent donations. So today we're here to speak about blood donations. We're going to try to educate you about the process, why the need is always there, and to see if we can encourage persons to get over the fear and to donate to our blood bank. Joining me is Mrs. Karen Louis from the National Blood Bank. Welcome to the Wellness Hour, Karen. Miss Louis.
Always a pleasure being here. Good morning, St. Lucia and the wider diaspora. It's always a pleasure being here. We do have a packed show. We do have a lot of information to give to our potential donors and also our donors that haven't donated in a while. We want you to come back home, come back and join the blood bank family.
All right. So just to begin and to set the pace, just let us know, what is your role at the blood bank? What do you do? I could hear the passion in your voice always when you speak about blood bank. Just let the viewers know a little about you.
My name is Karen Louis. I am a senior medical technologist at the Ezra Long Laboratory, Millennium Heights Medical Complex, and I am the blood bank supervisor. I have held this position for approximately 8 years. It feels like more sometimes. And my role is to assist. We have a blood bank consultant, Dr. Roy Torres, and he's a consultant hematologist, and he oversees the blood bank, and I am intern his assistant, I would say. So I supervise and we work together alongside 6 lovely ladies. So our blood bank is made up of 6 individuals. Well, Dr. Torres 7 and 6 lovely ladies. And we try to educate the public about blood donations, why the need for year-round consistent blood supply is important.
All right. Good stuff, Karen. Whenever I think of blood bank, I see you immediately. So sure. It definitely feels like it's more than 8 years that you've been the supervisor at the facility. All right. So in June, we had World Blood Bank Day, and I know the blood bank had a few initiatives surrounding that day, but again, to try and increase general awareness of blood donation. Tell us about what happened around that time.
So recently we conducted a blood campaign, and that's in the month of June. June 14th is known as International World Blood Donor Day. Mm-hmm. Our slogan in St. Lucia was give blood, share life, be a hero. And it emphasized, of course, the need for consistent voluntary, and we must stress on that, Doc, that we need voluntary blood donations. These are individuals that they are not coerced to come in. The only incentive, the only reward is given that invaluable gift of life. So we had a series of campaigns. We had informative posts on Facebook. We had TikTok videos, Instagram posts as well, culminating with 3 blood drives. On June 14th, we were at Constitution Park, where unfortunately we saw lower than expected numbers. We were ready and willing we had refreshments for our donors. We did put out on the media, thank you to Ezra the Fund Machine for putting out a post saying for persons to come to the blood bank, the need for blood, because he's one of our main donors. So we try to put the voice out there, the need out there. We try to use our local celebrities, but unfortunately we did not get a good turnout. We want to always say thank you to our churches. We went to the Therefore SDA Church. We had a successful blood drive there, and as well we went to the St. Lucia Medical and Dental Association. The office is located at Tapio, and we did have a successful blood drive. So I'm hoping in the next 4 months we can continue this campaign, we can make it bigger and better.
All right. And for sure, I recall these initiatives, and of course, being part of the St. Lucia Medical and Dental Association, I'm very proud to say that we were able to pull this off and have this blood drive. I donated. I'm proud to say that I was one of the persons who attended and donated. Our Chief Medical Officer, Dr. Sharon Belmar George, was there, other physicians, as well as members of the public. And it was really nice to be there to interact with people and to actually go through the process. So, you know, sometimes you try to tell people to do things without having done it yourself, but I can give first-hand experience and tell people about the process when we get there. Yeah. So coming out of these drives, one of the things you mentioned is the low turnout, and I'm sure there are times when the blood bank, because you visit the Boulevard weekly, yes. On average, how many persons would you say come to donate when you are stationed there at the William Peter Boulevard?
Generally, our target number every day is 14 units. We collect approximately 50%, so that's 7 units or 7 acceptable persons daily. That does not help us in the rapid demand for blood that we have on a daily basis. The average person uses about 2 to 4 pints of blood daily. So we are definitely not meeting that demand and supply for blood. So we would sometimes, unfortunately, especially during the carnival season, I know it was a successful one this year, but for us, we got lower than expected numbers from June to July for the carnival season. Most persons, they're in the fetting mood, but we need to make sure that we are always ready. The hurricane season is coming up, and it's now actually from June through November. We need to make sure that we have a reliable, constant, adequate supply to whatever emergency that may arise, that we are able to supply blood to all patients that need a transfusion. So we'll be on the boulevard. Sometimes we'll get 7, sometimes we'll get 6, sometimes we'll get only 2 units of blood, and we're there most times from 9 a.m. to 3:30 p.m. We also go to various locations. We've been to the Heineken St. Lucia, we've been to Unicoma at all their branches. We go to churches, we go to other business places, sports clubs. Give us a call at 458-6750. Or you can email us at ell.bloodbank@mhnc.lc. So give us a call. We want to meet you where you are. We are available Monday to Sunday. Give us a call. Let us know that you would like us to come to your establishment. We need to do workshops because it's all about educating St. Lucians and St. Lucians becoming blood bank ambassadors. And we want to, as we go further in our conversation, we're going to dispel some of the myths. We're going to go through the process and how long it takes. And if we have any unpleasant experiences, how can we deal with that? Because we always want to make sure that St. Lucians are well informed. So when someone tells them this is what the blood bank is like, they can say, no, I've been to the blood bank, I've donated blood before, and that's not how the team members at the blood bank operate.
Okay, so since you touched on the process, let's go ahead and delve into that a little bit, because a lot of times we fear the unknown. We are afraid because we're not sure what's going to happen. We think about, persons extracting blood from you. What is, that may be scary for a lot of people. So let's take a look at the blood bank, the blood donation process rather.
Right. So the blood donation process takes approximately 30 minutes. Now that 30 minutes is from the time you get to the first stage. We have 3 stages: registration, interview, and the actual blood withdrawal. The actual blood withdrawal might take again between 5 to 10 minutes, given the fact that every donor is different. Every vein is different. So, and again, it depends on the number of donors that we might have at the time at our donation center on our mobile blood bank. So we ask the public to give us some grace, because we want to make sure that we are doing every procedure professionally. We do have trained staff. We do not have any nurses. Someone asked do we have nurses in our blood bank? We do not have any nurses. We have medical laboratory assistants, not office attendants, not receptionists. Medical laboratory assistants are individuals that have basic science knowledge. They must have some form of science knowledge to understand. We also have phlebotomists. We have medical technologists like myself, and of course spearheaded by our consultant hematologist, Dr. Roy Torres.
So these are all persons who are trained specifically in the area
of blood
collection and processing blood samples.
And dealing with our donor reactions. If something happens, we know exactly what to do.
Okay.
So process takes about 30 minutes. Every donor is different. We try to be careful and sensitive with all our donors, professional with all our donors, and full consent of all donors at every single stage.
So you mentioned that there are 3 stages. So first would be the registration. Obviously you want to get some information from your donor and also to be able to contact them thereafter. Okay. Then you have the interview, the screening interview, where persons will be asked a few questions.
Correct.
About
their health and lifestyle.
Right.
And this is where we need to get an overall view of our donor inside and out, like we say. So we do need to ask some sensitive questions. We do need our donors to be honest, because our main aim is to protect you and subsequently the patient that might receive your blood. Then we go into the actual blood withdrawal stage. Again, our trained professional team members know exactly what to do. Again, have a discussion. If you are unaware, you can ask, what are you doing? And also our team members are also going to explain to you before they insert and do the blood withdrawal. They are going to say, I'm going to clean the area now. Are you allergic to latex? So have a discussion with our team members. We are here again to serve you donors. We respect our donors because without them we would have no blood bank.
Definitely. And so I hope that this is helping allay some of the fears of our donors. And again, I mean, as with anything, but especially some persons have a fear of a needle. I can say from experience that this was not a painful experience. Right. It was not an experience that caused any significant discomfort. Okay. Of course, you have a needle being inserted. You feel a little stick, but nothing that is significant. As you said, every donor is different. Some persons may have more difficult veins, and that is something that all healthcare providers experience when you have patients who come to the hospital, the clinic, or wherever else. Not everybody will be an easy stick. There are a few people who you may have difficulty with. So we don't want this to be a discouraging factor for persons. Perhaps you tried to donate once and it was, had to be stuck maybe twice before the vein was established. But these things happen. We're all human as well. We're not perfect. In terms of preparation, so for somebody who wants to go to donate, what should they do before? So a lot of people have these kinds of questions. Should I eat? Should I take my medication? Do I have to, what's some of the things?
Yes, you should take all medication, but especially if you have a cold, you would not be able to donate until probably 2 to 3 weeks after. All this is taken care of in our interview process. So before donating a pint of blood, making sure that you're hydrated, you're drinking lots of water, you're having a good night's rest, you're having a solid meal. Sometimes persons think like they're doing a test for some reason, so they might not eat. So you want to make sure that you have your oats. Again, we're talking about health and wellness. We need to make sure that we have a balanced diet. Our blood donors take care of themselves inside and out. They're making sure they drink their 8 glasses of water, their fruits, their vegetables, their protein, they're reducing on the fat, because we need to make sure the iron levels, which is what we do. So we do have to take a sample from the finger and drop it in our solution and check to see if you're eligible to donate. Post donation now, again, our ladies are going to explain everything from start to finish. We're going to avoid strenuous activity, so no gym on that day. That's going to be the rest day. We're going to make sure that we stay hydrated. We're drinking lots of fluids. Alcohol dehydrates you, so we're going to limit the alcohol intake on that day, and we're making sure that we drink lots of fluids, lots of water. We actually now are developing a short customer satisfaction survey, and we're excited to hear your feedback because it's all about elevating that donor experience. So persons that are first-time donors can now be repeat donors. One can donate from 17 years old with, of course, you must have permission. We do have permission slips for persons that are 17 to age 70. Men can donate every 3 months and women can donate every 4 months. So if every person between that age plays their part, St. Lucia, we will not have to see those Facebook posts, we will not have to see those WhatsApp posts.
All right. So let's go ahead. We have a short video that helps clear up some of the questions that, the potential donors may have. Let's take a look at that video, clearing up some of the myths around blood donation.
Think you can donate blood? Let's clear up some myths. Have a tattoo? Yes, you can after 1 year. COVID-19 vaccine? Yes, you can 2 weeks after your vaccine. Diabetic? You can donate whether you are taking oral medication or insulin, as long as your blood sugar is under control. High blood pressure? No problem, as long as you on your medication and your blood pressure is under control, you good to go. Taking medication. Most medication won't stop you from donating. It's the condition rather than the medication. Just let the blood bank staff know what meds you're on. Still unsure? Contact one of our blood bank centers today and let's break these myths together. Every drop counts and your blood donation saves lives.
So there you have it. I hope that answered a few more questions for you. Before we go to break, we will do our weekly wellness tip for this week. All right, so into this week's weekly wellness tip, we are looking at financial wellness. And our financial wellness tip speaks about paying yourself first, automating your finances, and helping to secure your financial future. So one of the ways that we can help our finances is to ensure that you prioritize your future. Think about that and pay yourself first. Essentially what that means is, every month you get your salary, or every 2 weeks, however it is that you're paid. We encourage persons to automate the process and ensure that you have a specific deduction going to a savings account. What that will do is it will take away the stress from you of having to think about it, so every month you're like, okay, I need to save $100 or I need to save $50. And you also have to now go to the bank, withdraw that money, switch the account, put it somewhere else. If you automate the process and make it automatic, it means that that money is going to be saved whether you think about it or not. It's almost like you don't even see it. A lot of times when you see the money, you might think, okay, I have something else to do this month, maybe I won't save it. So we encourage to automate the process, and that is going to help save time. It's going to make it more efficient for you. You will be able to be more consistent. You don't even have to think about the discipline of it because it's already being done for you. And it also, usually some of these accounts can help you take advantage of a higher interest rate or compound interest rate. And you can use those savings, for your retirement, to save for your children's education, for any goal that you have that you're trying to reach. We encourage persons to do this. And this week, I chose to do a financial wellness tip because, we're speaking about blood bank. And one of the things I always want to say is that we don't save when we need the money. We save for when we need the money. And the same thing applies to the blood bank. When a patient needs blood, they need it now. There is not enough time for them to solicit donations from family members and friends. It is usually an urgent situation. When we come back, we'll speak about, some of the different patients who need blood. But it's usually an urgent situation, and that you're required to be able to just go to your bank and withdraw. So you want to just call Karen and say you need blood and get. At that point, it's not the point to be trying to save. So this is something for us to all think about. So just like we save for our future, we need to save and we need to donate to the blood bank. And again, the life you save can be your own, because you donate last week, this week, God forbid something happens. It's summertime, your child is riding their bike, they're involved in a motor vehicle accident, they need surgery. It's an emergency. It needs to happen right away. So this is your weekly wellness tip, looking at financial wellness. Stay with us, the Wellness Hour will be right back.
Now you can take Hot FM, Kiss FM, and Hot 7 TV with you wherever you go. Whether you're in St. Lucia or exploring our four corners of the globe. Our record-breaking app has already been downloaded over 500,000 times on Google Play and the Apple App Store. To bring you the best in HD sound, we've relaunched a brand new app. Get it for free in the App Store by simply searching Caribbean Hot FM HD. Listen to us in real time, anywhere, any place, anytime. We've added so many cool new features, like our live in-studio option, where you can see your favorite announcers and DJs at work. So download the app today. It's free. Spread the news. St. Lucia is now in HD around the world on the Hot FM app. Don't miss out. Join the fun and stay connected.
Trans fats are unhealthy fats found in some foods. However, it can also be formed from our cooking habits. Did you know that reusing oil when frying can create trans fats? Or that using healthy oils for frying foods at high temperatures can also generate trans fats? Yes, it can. Avoid such practices to protect your health.
This message is brought to you by the Nutrition Unit of the Ministry of Health, Wellness and Elderly Affairs.
Here's your guide to installing Hot 7's digital antenna.
Please note that all TV sets manufactured today have a digital tuner. TV sets manufactured before the year 2005 may not have a built-in digital tuner, and you may not be able to receive our free-to-air digital transmission on Channel 7 to receive our free over-the-air digital HD TV service. Number 1. Plug your antenna into your TV set's RF input jack labeled antenna or cable in. Number 2. You will now have to scan for the digital channel. Please note that all digital TVs are different in terms of scanning procedures. The following is a general guide, but the steps or the terminology may be different for your device. Press the menu button on your TV remote. Go to Setup or Settings. Go to Installation or System or Channels. Go to Scan Channels, Program Channels, Auto Scan, Auto Program, or Auto Tuning. Press Select or Enter or OK to start the scan. When the device says scanning is complete, accept the channels found and close the menus.
Have you ever thought about the gift of life? Many don't until it's urgently needed. Here in St. Lucia, we often hear the call. Now it's time to heed the call. Newborns, sickle cell patients, renal patients, cancer fighters, accident and trauma victims, they all need your help. Your unit of blood can save up to 3 lives, 3 families, 3 futures forever transformed. It takes less than an hour to become a hero. Visit any of our blood donation centers Monday to Friday. OKEU from 8:15 a.m. to 5:30 p.m. Call us at 458-6748. St. Jude Hospital from 9 a.m. to 2:30 p.m. Telephone 459-6700. Schedule your donation today. This Christmas, give the gift of blood.
Welcome back to the Wellness Hour. I am Delphine Buna, joined with Ms. Karen Louis from the National Blood Bank. And there you saw some information about the National Blood Bank, telling you where you can donate, the times. Do you have anything to add to that?
So we also have our blood bank cell phone number at 729-9642 and our email address at ell.bloodbank@mhmc.lc. So if you have an unpleasant experience in Lucia, I must stress on that. We respect all our donors. So before we put something on WhatsApp, before we give the blood bank a negative light, again, give us a call. We want to hear from you. We want to understand you. We always want to make your donor experience a memorable one. We want to create a culture of awareness. We want St. Lucians to have that culture of them, not only like what Dr. Werner said, deposit when there is a call. The same for financial wellness. You always make sure you put money aside in case of an emergency. It's just like the blood bank. Blood only lasts for 35 days outside of the body, whereby the average person using at least 2 to 4 pints of blood, we need to make sure that we have that constant, reliable, adequate blood supply to sustain whatever emergency that may come along at either 2 a.m. or 5 p.m. And because we have a 3-step process, we do not just take the blood and then test. We do have to go through the registration, interview, and blood collection.
All right, so you can understand why at that time when a patient is in dire need of the blood is not the time where you want to be now collecting blood for that person. So this is the time where you want, if donors are coming, they are replacing what was in the blood bank that was given to their family member, and that is why we need the constant voluntary donation, and that's what we really want people to understand the need for and to encourage them. So again, you can also utilize these numbers to call in, and if you have any questions, if you want to know more about the process, if you want to invite the blood bank to come to your company or workplace, you can utilize those contact details for all of that. Right now, I would like to open up the lines in case anyone has a question and they would like to call in before we get into the rest of the discussion. So just to let you know, our phone number is 450-0777, 450-0777. You can feel free to call and we will address any question that you have. Something else that I want to say, a lot of times, I've heard persons say they're hesitant to go and donate blood. So we addressed, people being a little fearful of the unknown. One of the other things is that persons think, the blood is going to be going to somebody that they think is undeserving. Let's just put it that way. But I want people to be aware that there are so many different categories of patients that require blood transfusion, and it's something that is requested daily. And as Karen said, it could be any time of day because you can have an emergency at any time. Let's just speak a little bit about a few of the different classes of patients that need blood donation on a frequent basis. So when we look, let's start from pregnancy, before birth. This is a major category of persons that need blood. Some of our pregnant mothers
pre and post delivery, correct?
Both pre and post delivery are anemic, have low blood counts. We know the delivery process is one where you can have blood loss, and so you have to be prepared to address that
at that time.
You may also have a mother who has to go into an emergency cesarean section, so an emergency surgical procedure, which again puts her at risk for blood loss. So you want to have blood available to help replace that. You have women who post-delivery have significant postpartum bleeding, and so another reason why they need blood. We may also have the newborns.
Our VIP patients, we call them.
Yes, tell us about them.
Our preemies. So what sometimes we might need to do what is known as an exchange transfusion. So we need to take out and then we put it back in. So we need to make sure, and sometimes the parents aren't able to donate. So we need to make sure.
Just 1 second, not to cut you off.
We do
have a caller.
Oh, wonderful.
Yes, so
Good
let's
morning.
go ahead and take that caller. Good morning, caller. Thank you for calling.
I'm calling to say we're very proud of Miss Louie, but we'd also like her to remind the public of our opening hours.
No problem.
Okay,
Thank you so much, Ms. Edward. Thank you, one of our lovely ladies at the blood bank at OKEU. So our opening hours Monday to Friday are from 8:15 a.m. to 5:30 p.m. and on a Saturday we are open from 9 a.m. to 3 p.m. Again, making sure that we meet our donors where they are, convenient times for them, after working hours and on a weekend. Thank you so much.
All right. And
you're welcome. Thank you.
All right. Thank you for calling. Okay, so yes, so we spoke about our VIP patients, our little ones, and also in the pediatric population, another group that usually requires blood is persons who have, conditions such as sickle cell disease.
Yes, definitely. So we need to make sure for our sickle cell patients, they come in probably at least 4 to 5 times a year, taking at least, again, 2 to 3 pints of blood. So we need to make sure that we have blood available. Our dialysis patients, our cancer patients undergoing chemotherapy, our patients that have fibroids, and of course your unforeseen circumstances, your accidents, etc. I'm going to say that last because it happens. So we have to make sure that we have blood for all persons, regardless of race, lifestyle, religious affiliation. Once there is a need, we must heed to that call, and that we can only do with our donors, with you and with me.
Definitely. So as you can see, a wide cross-section of the population requiring blood, and as I said, and to reiterate, it is a daily need. And let me tell you,
we have had 1 or 2 instances in the casualty department.
Yes.
When doc has called and say, hey, we have a lady, she's bleeding, hemoglobin is 5, and she is pregnant. We need to make sure that we deliver right now. At 2-3 o'clock in the morning, doc has called me. Doctors have called us to say, hey, we need blood. And that is why, again, St. Lucia, we cannot stress that not only when we see a Facebook post, not only when we see a WhatsApp post, that persons need to donate. Bring your friends, bring your family, bring your crew. The same way for Carnival, we jump in together. Let's give blood together. Let's create that unity in which I know St. Lucians are that compassionate, empathetic set of persons. So let's practice that.
Yes, definitely. One of the things, another fear that persons may have in terms of donating blood is the risk of infection or possibly picking up something during the process. What can you say to the public regarding that?
Our standard blood testing protocols include, of course, doing your blood type. Again, we need all blood types at this point. We are critically low on all blood types. We know our most common blood type is O positive. We know our O negative can give to all blood types regardless if it's positive or negative. We test for your HIV 1 and 2, hepatitis B, hepatitis C, HTLV 1 and 2, and syphilis. These are known as your transfusion transmissible infections, which means that these tests can be passed on through a blood transfusion. Again, all our procedures are standard. We follow our World Health Organization guidelines, and we must say, in fact, we do not pay for blood. We do not sell blood. We do not offer payment for blood. That is why we follow guidelines by the WHO for voluntary unpaid donors, which are known as our safest set of donors. So rest assured, after we go through our interview process, which is our first set of screening, then we test our blood, and if we get any positive result, we immediately discard all blood products that can be made. And the 3 blood products that we make are red blood cells, plasma, and platelets. Red blood cells lasting for 35 days, platelets lasting for only 5 days. We have a patient right now that needs a constant supply of platelets. A dose of platelets is 6. So she needs to make sure that every day she gets at least 6 donors. She should not have to do that. We should always have that readily available supply of all blood products. So regardless again of the time, we can heed that call to serve you.
And again, just to put the numbers in perspective, so usually a platelet count of less than 150 is considered to be low.
Correct.
Sometimes just below that somebody can manage, maybe their body can build it back up, but a person with the condition who goes down to maybe 20s, 30s, 40s, 50s, that person needs replacements. And if each unit is only given 6, then you can imagine how much you need to try and get you as close to the normal range as possible. So again, with the blood counts, our normal blood counts for our females, some of us can survive with 10 or 11 depending on how it's going. Some of us acclimatize, but the average would be 11, 12. So when you have somebody who is anemic or who has a sudden blood loss and goes down, I've seen people go down to 3 that is critically low, and they need that life-saving intervention of the blood donation for them to survive, because the body is just not able to have enough blood volume in circulation with a blood count of 3 to 5. It's hard to adjust to that level. And remember, the blood is what carries our oxygen throughout our body. We cannot live without it. And that is why when you say blood donations are life-saving, they really are life-saving. There are 3 different components, as Karen said, that you get from each 1 pint of blood that's donated. So that's the other thing. We used to go about the 1 pint. What's the question people have? Like, how much blood do you take?
We take 400 to 500 ml, just call it about a Sprite bottle. And depending on your age, height, and size, the average person has about 9 to 10 pints of blood. So we just take in 1. And your body is so wonderful, so marvelous, that it automatically regenerates and makes new red blood cells by its own, by no effect of the person. So we're making sure that we have a balanced diet. We're making sure that our women, especially, having the iron-rich foods, your spinach, your lentils, your kale. These things have iron in it. So although we might have more women trying to donate, we sometimes have more men actually donating because of those low iron levels. For our men in particular, unfortunately, we've seen the increase of them being deferred because of their blood pressure. We need, again, health and wellness. A healthy nation is a wealthy nation. The differences and the choices that we make not only affects us, but affects our neighbor. And if we want to help our neighbor, we want to help our mother, our daughter, we need to make sure that we are healthy.
Definitely. So believe it or not, we're like pretty much out of time.
Are you kidding me?
So just before we go to our announcements for this week, I'll just give you a minute to wrap up and your final encouraging words for our listeners.
Once again, it is always a pleasure. We should not be doing this only once a year. We need to make this, more than one. But we want everybody to help out. We want you to give blood, share life, be a hero. Every pint that you donate is an act of compassion that not only saves lives but strengthens our community. That 1 pint of blood that you donate is going to give hope to someone tomorrow. And we can only do this with your help, St. Lucia. Like I said, we are open Monday to Friday, 8:15 to 5:30 p.m. on a Saturday from 9 a.m. to 3 p.m. Make sure you eat, make sure you have a balanced diet before donating, and we'll be happy to serve you.
All right. Thank you so much for those words, Karen. And thank you so much, listeners, for staying with us throughout this time. I hope we were able to answer some of your questions, address some of your concerns about blood donation, allay the fears. And I hope that after this, we will see an influx of patients to the blood bank to donate. And what we want persons to know is to be aware and to continue to go. So we don't want to just go this one time. We want you to come back in 3 to 4 months and give a second donation, because that's the only way that we'll be able to sustain the blood bank. We want you to automate it, right? So you put a little note every 3-4 months that you will return to the blood bank and give this life-saving gesture. And before we conclude today's program, just want to remind everyone of the relocation of the Sexual and Reproductive Health Clinic. It's formerly known as the STI Clinic, which had been at the Cicero Wellness Center, has now been relocated to the Dr. Betty Wells Urban Polyclinic, which is at the former Victoria Hospital site. The clinic is open daily for your needs, so we encourage all persons who were previously members of the clinic or persons who need new information, testing services. The persons at the Sexual and Reproductive Health Clinic are ready to serve you at the Dr. Betty Wells Urban Clinic. You can contact them via the number 285-9275. Again, 285-9275. You can call if you have any questions, if you want to set an appointment, if you need any information, do feel free to reach out to them. And that's it. We are at the end of another hour. I want to thank our viewers and listeners for joining us again. I'm really happy we got to have this show, Miss Louie, and I would like to say to everyone, do your best. encourage someone else if you are not able to, because we do recognize that not everyone is able to donate, but at least if you could share the information that you received today with somebody else and encourage them, perhaps we'll be able to see a more constant supply of donors and to have a more well-stocked blood bank. The life you save could be your own. That's what always should drive us. So thank you once again for staying with us. I'm Delphina Werner. Until next time, do take care and be safe.